So I want to share some of these treatments and show you these different treatments. But then more generally, I want to talk about acupuncture and moxibustion in a more general sense of those who were in my workshop on Wednesday will recall my distinction between acupuncture as a regulation therapy versus acupuncture as a stimulation therapy. When we apply acupuncture as a regulation therapy, what we're doing is we're trying to improve the overall condition of qi in the patient without provoking too much strong response. Just sort of lightly guide the position to become the meridian system, the qi circulation system to become more balanced, to operate better, etc. And that usually requires very soft techniques. So I want to explain again some very simple needle and moxa, soft techniques that are very helpful when a patient is really challenged and can't deal with much stimulation. And then also I want to talk about some simple stimulation techniques, especially direct moxa, because it has certain biological advantages, and if you understand how to use those advantages, you can make them match the needs of certain patients very well. So we will be looking at a variety of techniques later, but first I want to get into the more general things. And I'm very low tech. I'm only just learning how to use PowerPoint, so I don't have a PowerPoint presentation. I have a few overheads, so I hope that's okay. I'm gradually creeping out of the 20th century. The first thing I'd like to talk about is judging the correct dose of treatment and the sensitive patient. And it'll become clear very quickly why I'm talking about this, okay? So you've all had the experience, you treat somebody and these are really big things start happening immediately and you think, either you pat yourself on the back and think, oh, look at me, aren't I wonderful? Or you understand, oh, there's something different about this patient than my normal patient. They're reacting much more quickly and sometimes uncontrollably to the treatment that I'm doing. And that's because they're very sensitive. And while everybody would like to be very sensitive, not everybody is. And being very sensitive can be difficult because the patient can't receive treatment without having overreactions. And I want to model this for you.